Hello there. I welcome you all to Neuropedia. My name is Dr. Arif Khan. I'm a consultant pediatric neurologist and I'm the founder and director for Neuropedia Children's Neuroscience Center. I'm here today to talk to you about the first children's ketogenic diet service for epilepsy that we're developing here at Neuropedia. And before we start with that, the moment you hear the word ketogenic diet, what comes to your mind is weight loss. But there is much more to ketogenic diet than just weight loss. I'm talking about the medical management side. Ketogenic diet has been used for treatments of cancers, for treatment of metabolic conditions, and of course for epilepsy. And that's what I'm going to talk to you about today. So what is ketogenic diet? Ketogenic diet is a diet that involves high fat, low carbohydrate and an optimal protein diet that switches your body fuel source from that of glucose to ketones. Now, let me explain that a little bit. When you ingest a lot of carbohydrates in the form of bread, rice and so forth, you break that down to give yourself glucose, which is utilized for energy. But by getting onto ketogenic diet, you're shifting that balance by having a lot of fat, which breaks down into ketones, and here ketones is used as a fuel rather than glucose. How ketones helps control epilepsy, we still don't know, but there have been a lot of studies carried out that it brings down the seizure frequency in children with epilepsy. With ketogenic diet, it's been used for more than a century, but it has its ups and downs. There were times when ketogenic diet was used for epilepsy in the 1920s. And then with the kind of advent of a number of different anti-epileptic drugs, the use of ketogenic diet fell. And it came back in the late 90s. And that's predominantly because of a movie that came out that's called First to No Harm, which starred Meryl Streep. I'd suggest please go and have a watch that movie. It's just fantastic and gives you an overview of what ketogenic diet can do for epilepsy. Let me tell you a little about how ketogenic diet is used in children with refractory epilepsy or difficult to treat epilepsy. We know that about 65 to 70% of children who have epilepsy can be controlled using medications. Some children need one, some need more than that. But there is a group of 30 or 35% of those children who would not respond to anti-epileptic medication, and alternative forms of treatment have to be looked at. Ketogenic diet is one of those. So if a child is having a diagnosis of epilepsy and has failed 2 or more appropriate anti-epileptic medication, they would be an ideal candidate to go through a trial of ketogenic diet. It is used in refractory epilepsy. We know that it is used in some specific epileptic syndromes. And people ask me, what would my child get by starting ketogenic diet? It reduces the seizure frequency by more than 50% in about 50% of those children. And in some children, up to 10%, it reduces to more than 90%. So overall, it improves the quality of life that your child would have. So how ketogenic diet is initiated in a child? You're seen by a pediatric neurologist like myself. I discuss the pros and cons of starting the ketogenic diet and check whether your child is eligible and amenable to ketogenic diet. After doing the initial growth assessments and metabolic assessments of his or her body status, I refer your child to our specialist ketogenic dietitian. Now, this person or this professional is the key. He or she has frequent discussions with you on telephone and in person, helps you monitor the ketogenic diet, and also helps you look out for complications if there were any. So initially, when the ketogenic diet starts, you would be interacting with a specialist ketogenic dietitian to help you have a smooth transition from a normal diet onto ketogenic diet for your child. In the team, you would also have a specialist nurse who would help your child monitor his or her growth and make sure the appointments are kept on time. So the ketogenic dietitian makes sure that your child's body status in terms of its metabolic balance is always there. Sometimes a child needs to have certain supplementations. Sometimes they have to have some addition of fat in the form of MCT oils or in the form of a natural source of fat. Along with this, there would be daily ketone monitoring from the child's urine sample and sometimes the blood sample. And every 3 to 6 months, they have to get an entire metabolic blood analysis done to make sure that there are no subtle evidences of complications arising. But overall, the team works towards establishing the ketogenic diet in your child in a very smooth manner. And in the first 3 or 4 months, it would give you an idea whether ketogenic diet is helping improve the quality of life and reducing the seizure frequency. And if it does, then it can be continued for 2 years, maybe up to even 5 years, and then slowly weaned off after that. Any children out there who have had epilepsy or who are suffering from epilepsy, have been tried on 2 or more anti-epileptic drugs, this is one of the options. So do get in touch with us at Neuropedia or contact one of the clinicians here, including myself or our ketogenic dietitian. Have a great day. Thank you.